Welcome. Now we are towards the end of the carbohydrate. We are going to discuss the uronic acid pathway, the alcohol metabolism. They are not very important. They are just few facts to be remembered. When it comes to uronic acid pathway, it's a long pathway, but we don't have to. Fortunately, we don't have to remember the entire pathway. The glucose can convert into uronic acid, and we know that the uronic acid will be used for the GAG synthesis, right? And to do this process, we require an enzyme called as xylitol dehydrogenase. Now, why we are discussing this uronic acid pathway, right? The determining enzyme for uronic acid pathway is xylitol dehydrogenase. The main important point is this uronic acid could have been converted into ascorbic acid, which is the other name of vitamin C. So, from uronic acid, we can make vitamin C, or in other words, from glucose, we can make vitamin C. To make the vitamin C, we require one enzyme that is L-gulonolactone oxidase. Because this enzyme, gulonolactone oxidase, is physiologically absent in humans, that is why we can't make vitamin C in our body. If this enzyme would have been there in our body, we would have never been deficiency of vitamin C, right? But unfortunately, we don't have this enzyme, so we can't make the vitamin C in our body. So this is one MCQ, that why we cannot make the vitamin C, because we don't have this enzyme. So there are 2 points to be remembered. If there is a deficiency of xylitol dehydrogenase, if this is there, then this is called as essential pentosouria. And the second statement to be remembered is due to physiological absence of L-gulonolactone oxidase, humans are unable to make vitamin C in the body because we don't have this enzyme. There are 2 points to be remembered. Essential pentosouria, there is nothing is going to happen. There is asymptomatic pentose will be coming in the urine. That is essential pentosouria. There is something called as Garrot's tetrad. What is Garrot's tetrad is, if someone is having essential pentosouria, it is seen that the patient can also have alkaptonuria, can have cystinuria, can have albinism. If all these 4 are together, then it is called as the Garrot's tetrad. And we have discussed them in the chapter of amino acid. If you remember the alkaptonuria, cystinuria, albinism, we have discussed there. So if essential pentosouria is with these 3, then it is called as the Garrot's tetrad. Garrot's tetrad. Now coming to your favorite one, the alcohol metabolism. When it comes to alcohol, the alcohol which you are drinking, it is basically ethanol. The drinking alcohol is ethanol. So we have the different percentage of ethanol in different drinks. For example, in beer you will have 4%, 8%. In vodka it may be 40%, 45%. If you go more, maybe in tequila it may be more, right? If you go to absinthe, it's going to be more. If you go to spirits, there is going to be 95% ethanol will be there. So when you are drinking alcohol, you may have seen that how much percent ethanol is there. It is written on that bottle. So the drinking alcohol that we are talking about is ethanol. The moment you drink ethanol, it will be absorbed in your intestine. It will go to the liver in the hepatocytes. In the hepatocytes, this ethanol can convert into a molecule called as acetaldehyde. And to convert the ethanol into acetaldehyde, we have the enzyme that is ethanol dehydrogenase. Then this acetaldehyde will go inside the mitochondria of the hepatocyte and can convert into a molecule called as acetate. And for that, the name of the enzyme is acetaldehyde dehydrogenase. And this acetate, this is the last product of the alcohol metabolism, and this is harmless. This is harmless. It does not create any problem. And this is the last product. Then you must be wondering then why the alcohol is creating the problem. If the end product of alcohol metabolism is harmless, then what is the problem with alcohol? See, I will come back to this. Just answer me one question. what is the driving limit of alcohol in India? What is the legal driving limit of alcohol in India? Yes, it is 30 milligram per deciliter. The legal driving limit of alcohol in India is 30 milligram per deciliter, means in your blood, 1 deciliter of blood, the alcohol concentration should be less than 30 milligram, or in percentage, if I write, less than 0.03%. This should be, the alcohol should be that much less. But when you are going to drink, you are not going to stop at that much lower level. It is very hard. It's almost impossible to stop at that level. So whenever you drink, you are going to go higher than that. For example, when you reach at the level of 100, for example, now you answer me the question, what you feel at the level of 100? If you have ever taken the alcohol, which is most likely the probability, how at the level of 100 the patient is going to feel, how the person is going to feel? He is going to feel very confident. He's going to feel very confident, and he's going to feel like as if, although the temperature may be 40 degrees Celsius outside, but he will feel that, okay, the cool wind is blowing and everything is very cool, smooth, and the life is completely settled. There is no exam, right? He's going to feel like this. He's going to be very happy. Then we are not going to stop here. We'll go forward. We'll drink further. 200. If you reach at the level of 200, can you tell me what the patient is going to feel? At the level of 200, how you are going to feel? If there are, let's say, 5 persons are there in that room and they are doing the party, here you are at the level of 200. Now, these are the real brothers from the different mothers, right? These are my real brothers. This is one of the common things that happens. If you don't stop there, you go forward and you reach at the level of 300. What is going to happen at that point? Irrespective of your native state, whether you are from Kerala, Tamil Nadu, Rajasthan, Gujarat, Himachal, Delhi, anywhere, at the level of 300, now you will walk in English, talk in English, the music will be turned into English. Everything will be now in English. How hard drinker you are. No one in this classroom, how hard you drinker are, no one has reached at the level of 400 so far. In this classroom at least. Because at the level of 400, there's going to be death. So these are some events that happens with alcohol, right? So the point is, when it comes to the alcohol metabolism, we are saying that the alcohol metabolites, the ultimate metabolite is harmless. Then what is the problem? The problem is there are only 2 enzymes which is going to work, and out of them, the first enzyme is very fast. The second enzyme is very slow. Because the first enzyme is very fast, the moment you drink alcohol, it will convert into acetaldehyde immediately. Immediately it will convert into acetaldehyde, and that slowly will convert into acetate. So because of that, because the first enzyme is very fast, so this molecule is going to accumulate. And the moment this molecule is going to accumulate, the problem with this molecule is it will lead to headache, nausea, vomiting, that you commonly refer as hangover. So the hangover is because of this molecule. The liver damage is because of this molecule, the acetaldehyde. And the main reason behind that, because the first enzyme was fast and the second enzyme was slow. So the intermediate has accumulated. And the acetaldehyde accumulation happened, and that is going to create the problem. The headache, nausea, vomiting, that is going to be there, the liver damage, right? So now you have understood that why hangover occurs. Can you tell me how to avoid hangover? You have understood why it is happening, how to avoid it. Okay, if you are thinking that we will drink slowly and we'll try to match the speed of enzyme 1 with enzyme 2, then it is going to be the second best answer, because it's logically it is there, but if you see practically, it's impossible that you will, the moment you drink, first it converts into acetaldehyde, then it converts into acetate, and then you are going to take the second drink. It is not going to be possible, because you are sitting with the community. Everyone is drinking, you will also drink. So that is not going to work. The best answer is do not drink, right? But that was not coming in our mind, right? So the best to avoid hangover, do not drink. Now, okay, the point is, we understood that acetaldehyde accumulation leads to hangover. For example, wife is coming to you from couple, and family members are coming, and one of the family member is a chronic drinker. They want that that particular guy should stop drinking, and they are coming to you for the help. Then what you will do is, you will give them a drug with the name of disulfiram. You can give a drug with the name of disulfiram. What this disulfiram can do is, the disulfiram can inhibit the second enzyme, which was already slow. Just imagine that if you block this enzyme, what is going to accumulate more in the body? Yes, this acetaldehyde is going to accumulate more, and that will create more problem. So what you will do is, you will give this tablet disulfiram to the family members, and you will tell the family members that give it to your patient and give him unknowingly. Maybe in the sandwich, maybe in the chapati, somewhere you put it and give it and let him drink. And you just watch the show, right? He's going to drink, acetaldehyde is going to accumulate, he's going to have nausea, vomiting. Instead of the pleasure, he's going to have this thing. So you will give him disulfiram multiple times and he's going to drink on that. It's gone. He's not going to get pleasure, right? And this is how the habit of drinking may be quitted. But that ethically doesn't look good, right? You are giving trouble to a person. That doesn't look good. So there is one more drug that can be used. There is one drug that inhibits the ethanol dehydrogenase. If you inhibit this drug, the patient will neither feel good nor will feel bad. And the name of that drug is famotidine. So there are two drugs which can work on the alcohol metabolism. The disulfiram can inhibit the second enzyme, which is the slower one, and the famotidine can inhibit the first enzyme, that is ethanol dehydrogenase. So this is a very short discussion about the alcohol metabolism, and this is how it is correlated with the pharmacology, right? So with this, we are going to end with this particular chapter. Thank you.